Good morning, everyone. We'll be presenting on dysautonomia. So what is dysautonomia? It's a group of disorders affecting the autonomic nervous system function. It's also known as the autonomic dysfunction or autonomic neuropathy. And as we know, the autonomic nervous system controls involuntary movements, including respiratory rate, heart rate, blood pressure, and etc. This condition affects 70 million people around the world, and men and women are equally affected, and it can be present at birth or any age. There are around 15 types of dysautonomia, and we'll be going into 4 types in our presentation. So there's primary dysautonomia, which is usually inherited or due to a degenerative disease, or secondary dysautonomia resulting from another condition or injury. And the most common type is called neurocardiogenic syncope, and it affects millions globally. So this is just a little summary of the 2 arms of the autonomic nervous system, the sympathetic and the parasympathetic nervous systems. So we know the autonomic nervous systems controls functions that we normally don't consciously think about. So primary dysautonomia occurs on its own without the presence of another disease. Secondary dysautonomia occurs as a condition of another disease. And these are a few examples: diabetes, and the most common identifiable cause of neuropathy, and it affects approximately 20% of diabetics who develop a more serious version called cardiac autonomic neuropathy, and this increases the chance of mortality. Then Parkinson's disease, it impacts about 80% of patients with Parkinson's. It could be a side effect of the medication used to treat Parkinson's, or it could just be a part of the neurodegenerative disease process. Crohn's disease and ulcerative colitis, both are forms of inflammatory bowel disease, and about 50% of patients develop symptoms of autonomic dysfunction. And with celiac disease, neurological disorders are thought to occur in about 6 to 10% of those patients. They have autonomic neuropathy, peripheral neuropathy, and ataxia, which can appear in people with celiac disease. And with the prevalence of celiac disease in the United States, there's about 1 in every 133 people. And a recent study showed that 83% of people are still remain undiagnosed, and this delay of diagnosis increases a person's chance of developing neurological disorders and additional autoimmune diseases and osteoporosis and cancer. So we're going to get into the 4 types of dysautonomia that we'll discuss today. So the first one, which is the most common form, is the neurocardiogenic syncope. It's also called situational syncope or vasovagal syncope. Millions are affected worldwide, and it can be mild with 1 or 2 fainting spells in a lifetime, or it can cause fainting multiple times a day, which can lead to falls, broken bones, or even traumatic brain injuries. So because of the frequent fainting attacks, those with moderate to severe neurocardiogenic syncope have difficulty engaging in work, school, and social activities. So the next one is the postural orthostatic tachycardia syndrome, or POTS. It causes problems with circulation. It leads to lightheadedness, fainting, tachycardia, chest pain, shortness of breath, gastrointestinal upset, shaking, exercise intolerance, temperature sensitivity, and etc. So the estimated impact is about 1 out of 100 young adults and about 3 million Americans total. It predominantly affects women, and the condition has been compared to the disabilities seen in COPD and CHF. The next one is familial dysautonomia, which is the inherited form. It causes a decreased pain sensitivity, lack of eye tears, and trouble regulating body temperature, and is more likely to affect the Ashkenazi Jews of Eastern European heritage. And the final one that we'll discuss is the fatal form, the multiple system atrophy, and that occurs in adults over 40. It's considered a rare disease with an estimated 350,000 patients worldwide, and it's a neurodegenerative disorder comparable to Parkinson's disease. But unlike Parkinson's disease, patients with multiple system atrophy become completely bedridden within 2 years of diagnosis and die within 5 to 10 years. This can lead to arrhythmias, hypotension, erectile dysfunction, and loss of bladder control. So, dysautonomia occurs when the nerves in the autonomic nervous system don't communicate properly. And like we mentioned earlier, it affects some of the functions of the autonomic nervous system, such as blood pressure, breathing, your digestion, heart rate, kidney function, pupil dilation and constriction of the eyes, sexual function, and your body and skin temperature.
Good afternoon, everyone. This is Nashka, continuing on with the risk factors. So people may be at high risk for dysautonomia if they are a Jewish person of Eastern European heritage, only for the family dysautonomia form of the condition, if they are diabetic, amyloidosis, certain immune disease, and other medical conditions, or if they have a family member with the disorder. As for the symptoms, there are many symptoms of dysthymia that varies from patient to patient, and a common sign is an orthostatic intolerance, and it is when you can't stand for a long period of time without feeling faint or dizziness. Certain triggers can bring these symptoms, such as alcohol consumption, dehydration, stress, tight clothing, and hot environment. And if you look on the diagram on the right, it lists all the symptoms of the dysautonomia, such as balance problem, shortness of breath, mood swing, weakness, dehydration, low blood sugar, sleeping problems, and exercise intolerance as well. So, in order to diagnose dysautonomia, your doctor will perform a physical exam and order many tests, including some diagnosis tests such as the tilt table test. And for that exam, you basically lie on a table that lift and lower at different angles, and it has your support for your feet. You are connected to a medical equipment that measures your blood pressure, oxygen levels, and heart electrical activities. So when the table is tilted upward, the machine measures how your body regulates the ANS functions, like the blood pressure and heart rate. Other tests include the sweating test, the breathing test, heart workup, blood tests, as well as nerve or muscle biopsies. Other tests may be done to determine if other diseases or conditions are causing dysautonomia. Currently, for the treatments, there's no treatments for primary dysautonomia, but there are only treatments available to improve the quality of life. Secondary dysautonomia can be improved with treatments of the underlying disease, and even with treatments, dysautonomia is very debilitating to patients, eventually reducing their quality of life. So some supportive measures include elevation of the bed, elevation of the head of the bed, a high salt diet, and drugs such as fludrocortisone and midodrine. Sorry, and also adding salt, extra salt to your diet. Salt helps your body keeps a normal fluid volume and your blood vessels, which helps maintain a normal blood pressure. as well as taking the medicines mentioned above to increase your blood pressure.
So with prevention, you cannot prevent dysautonomia, but there are steps to help to maintain symptoms so the symptom doesn't get worse. These steps include not smoking or drink alcoholic beverages, and eating healthy, drink a lot of water, get plenty of sleep, maintain a healthy diet, keep like your blood sugar level within the normal limit. If you have diabetes, wear compression socks, stockings, or support garments to increase or maintain the blood pressure. Avoid standing or sitting for a long period of time. You avoid heat, so like lukewarm or cold baths or shower are normally recommended. Next slide. Some complications. So the complication of dysautonomia, they varies depending on the symptoms of different people, which can include the, one second, sorry, which can include the arrhythmia, which includes like your heart rate that is whether it's too fast, too slow, or irregular, and syncope or fainting, breathing trouble or digestive problems, vision problems such as blurry vision, and then you have life-threatening problems such as pneumonia or respiratory failures. So there's a lot of like ongoing studies that we have found that have not yet been like concluded, but we were able to found like one study that with results. So moving on to the clinical or first clinical trial here, we have the para and the post-infectious autonomic dysfunction study. It's an observational study by the Mayo Clinic. It aimed to identify specific infectious diseases associated with the autonomic dysfunction and to characterize like pattern of the autonomic dysfunction. Inclusion characteristic: patient age 18 years or older with the abnormal autonomic reflex screen or ARS from like 2000 onwards, and a prior history of infection confirmed by history or serial study. The exclusion criteria: patients with alternative explanation for abnormal autonomic reflex screen results, that is like with medication effects or prior medical no prior history of infection. And like I stated before, this is also one of the clinical trials that is still in progress, so therefore there's no result that have been made. And moving on to the second trial that we found, it is a acupuncture for the treatment of autonomic dysfunction study, and this one is an interventional study by the Mayo Clinic again. And the purpose of this study is to demonstrate the benefit of acupuncture in patients who have refractory autonomic dysfunction, includes like nausea, emesis, ileus, diabetic gastroparesis, failure to strive. And the inclusion criteria is the intractable nausea, emesis, ileus, and failure to strive. The exclusion criteria: we have the advanced immunosuppression, and you have a temporal illnesses and support sepsis or bacteremia. Like I said again, this result, this clinical trial is one of the ones that are still in progress, so therefore there's no result that have been made. So here we have a research article on April 13 of the 2021. The Frontiers in the Neurological, they published this articles of COVID-19, dysautonomia. It was a retrospective review of 6 patients, 4 females, 2 males with age range of 22 to 66 years old, with like suspected signs and like symptoms of dysautonomia, who underwent like autonomic testing. It said that all patients had the symptoms of COVID, but they were not hospitalized. All patients, they reported with symptoms of like the postural lightheaded and the near syncope or fatigue and activity intolerance. 5 of these patients, they reported an onset autonomic symptom accompanied with other COVID-19 symptoms, with the other patient reported symptoms of onset 6 weeks following initial COVID symptoms. The result concluded that the autonomic tested, it demonstrated an excessive postural tachycardia in like 4 patients and a hypotensive response with head up like tilt in 3 patients, and orthostatic hypotension in 1 patient and a pseudomonal impairment in 1 of the patient with excessive posterior tachycardia. Further studies are needed to basically like explore the prevalence and the pathophysiology, clinical features, and treatment approach in patients with COVID-19 related to dysautonomia. And with that said, this concludes, the next slide would be your references, and this concludes our presentation.